Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management. If you're joining us for the first time, thank you for listening. And if you are tuning in again, welcome back. And lastly, if you find today's episode or any of these episodes of this podcast to be helpful or insightful, please follow and rate this podcast on whatever platform you're using. The more followers and ratings we get, the more we can help people like you. And without further ado, let's get started. One of the really cool things about this upcoming season is that I plan on interviewing a lot of different experts on subjects and tools that I actually don't have the greatest knowledge or the capability because the majority of the people I work with are virtual. And so today we're going to be discussing specifically spinal traction. There's a lot of different traction modalities and ways for people to conduct this motion, but we have Dr. Jeff Fisher, who is the founder of Fisher Traction, and he's going to tell us a little bit more about this device and how it's actually going to help other people. So Jeff, thank you so much for being on today's episode. How you doing?
Doing great. Thanks for having me on. I totally appreciate it.
Of course. And so let's get right into it. Tell us a little bit more about yourself, your journey to where you're at today. And then we'll take a deep dive into traction.
Well, it's a long, boring story, but I've been a chiropractor now for 32 years. My godfather, Dennis McCowan, who's actually one of our past presidents of our state board in California, he was a chiropractor. My dad's best friend, my dad's best man in his wedding, and my dad was Dennis's best man in his wedding. He was like another father to me. He practiced for 40 years as a chiropractor, and it was just like a natural progression for me to become a chiropractor. He used to treat me, actually, great story, when I was about 8 years old. My dad snuck me over to see my Uncle Dennis to start adjusting me because my mom was terrified of me getting adjusted at a young age. And I had really bad migraines, and my migraines are gone. I remember having them, but then I just don't ever remember having them again. And one night at dinner, after my headaches were gone for months, my mom was bragging about, I don't know what I've done, but Jeffrey's headaches are all gone. And my dad said, you know what? I can't hold this back anymore. I've been taking Jeff to see Dennis. And she's like, what? Oh my God. After that, my mom took me to Dennis for everything. So I love chiropractic, been around it my whole life. I've been in private practice by myself now for many, many years. And I teach at the Southern California University of Health Sciences in Whittier. I'm a clinician where I supervise our interns at an outside clinic, which is really close by my office, which is it's a great opportunity. It's called the Orange County Rescue Mission. It's just a great purpose place, treat a lot of patients. And then I have interns in my office too. I'm a PPR doctor. So it's really fun. I love being around the younger, kids. I call them kids because they're like my children's age, but they're at the 5-yard line of becoming doctors of chiropractic. So it's really great to have them at that point in their life and their career where I can just download as much my experience as I possibly can on them. So, but I've worked in traditional chiropractic, environments. And then I was in an outpatient surgical center for, probably about 6 years before I moved to this office here where I've been in for about 14 years. And I've worked with, pain management docs, orthopedists. We had a great facility. It was this outpatient surgical center. We had an MRI in-house. We had the surgical operatories downstairs. And I actually I've had 2 of my surgeries from my neck in that operatory. And I guess that's kind of a good segue because my reason why I created Fisher Traction, like the saying goes, necessity is the mother or father of invention. And I was a horribly slow football player back in my day. So I was injured multiple times, probably had a disc herniation, even back in high school, but we didn't have MRIs back then to diagnose, types of injuries like that. But I always had neck problems, and I was playing softball with a bunch of buddies, and I dove for a ball in the outfield, and I ruptured at C5, C6. I actually had an enormous disc herniation. It was 10 millimeters wide, and it came out extruded 2 millimeters. So I had this massive disc herniation, and I was in agony. And I was practicing. I had a family, I had kids at the time, so I couldn't afford not to work. So I was in my office treating patients, and I had traction there, but unfortunately, I really couldn't use it because my patients were using it. So at night, when I would go home, I would just start rigging things up on our staircase, and I just had an aha moment, and I grabbed some bungees and I stretched them out, and I wrapped a towel around my head. And honest to God, it was the first time I had slept in probably a week. And my wife literally just came and laid a blanket over me. And I slept out in the hall with my first version of Fisher traction attached to my head. And it was amazing. So from that, I would tinker with it periodically. And then I actually used my patients to experiment on for many years. And I rigged up different prototypes of my Fisher traction in my office, and my patients loved it. They're like, "Oh my God, this is fantastic." And, my patients kept telling me, and my family kept telling me, you should make these things. You should, get it patented and sell them. Like, whatever, I got other things going on. And it wasn't until, years later, my wife had for her, because she's not that big, she's only about 5'5", about 115 pounds. She had a 7 millimeter disc herniation in her low back, and it actually caused massive sciatica for her. And so at home, I thought, what? Let me pull this old thing out and let's look at it and see if I can, modify it. Where it could attach to her hips, and we could apply traction on her low back. And sure enough, we did. And she had instant relief. It was an amazing, thing that happened to her and me, because it really opened my eyes to the power of traction, for the neck and the low back. I use it in my practice, but, I just didn't see it that quick, because usually people come in after they've had it for a while, as in our practices. But from that, I really said, what, I have to really fine tune this, and I need to get this out to the masses. And so I did. I committed to it. I couldn't believe that somebody else didn't already invent it. But we submitted our United States patent application, and I was patented, I think, in 2014. It was a long process, expensive process, but sure enough, came back, and no one had ever created a utility patent. So I literally invented a new form of traction that had never, it hasn't existed before. Just super, super thankful that it came to me, and now, we've sold over 30,000 units, and we haven't even been selling it for 3 years yet. And it's just such an incredible, you know how it is in a practice when your patients tell you, "Thank you so much. You've helped you," and you spend all this time and effort with them. You get to know them. I have people I've never met, they're complete strangers, giving us these amazing reviews and telling us how it's changed their lives. And it's so empowering. It makes me feel so good. And I'm so thankful I'm able to help people out and outside of my office, so that's kind of where we're at now. Now we're trying to juggle, two kids that one just graduated from college and the other one's still in college. I got my practice and I got Fisher traction. I got enough.
We are going to take a quick break to tell you about our awesome new program called the Sciatica Protocol. If you don't have the time to see a professional, but are tired of trying to figure out this recovery on your own, then the Sciatica protocol is for you. Harness the power of a knowledgeable physical therapist through your phone. It takes no more than 7 minutes per day, and it is designed to help you recover as quickly as possible. Now, having an on-demand physical therapist can cost thousands plus hours of sessions. But with the Sciatica protocol, you'll receive the same, if not better, customized care completely free. And why are we making this program free? Because I believe that everyone deserves to live free from pain without actually having cost be the biggest obstacle. It is simple to start, and all you need to do is log into ifixyoursciatica.com/the-sciatica-protocol and fill out the 9-question quiz to begin. The link for the program is in today's show notes. Sounds like you're a busy guy. What a cool journey, Jeff, where not only was the profession running your family, but you actually had the opportunity to experience what it was like to be a patient. And I think one of the interesting things, and you probably noticed this as well, is like us healthcare professionals, like we're not the best patients, because oftentimes we're like, oh, we like feel this, but I think we're going to get through it. And it's a shame that you had to go through such agony, but in a way, it actually led you to finding this new technique. And so let's talk a little bit about the different forms of traction. I think when people hear the word traction, well, one, when I hear, I just like think of what I was taught in school, but then also number two, a lot of people are like, I have no idea what traction is. So can you tell us a little bit more about like the general term of what traction is, and then the common forms, and then what Fisher traction does?
So basically, traction is any forces that are pulling away at a joint. And it can be any joint in the body. You can do traction on the shoulder, you can do it on the elbow, the wrist, the hip. There's great physical therapy moves where you're tracting the hip, the knee. But spinal traction and decompression really hit the forefront of healthcare about actually 20 years ago. And there's been a great deal of research and time spent on modifying different forms of traction. And typically in a healthcare setting, like an office like mine or in a physical therapy facility, you'll see the large traction tables where a certain section of the body is anchored down in some fashion with strapping. And then the other side of the table, there's some type of pulling force that's separating the spine. And a really cool thing that happened with traction is that I don't even know who it was that experimented with it originally, but they started implementing these logarithmic pulls and relaxations. And the reasoning behind it is that it's a technical term, but I'll explain it. It's called imbibition. And our discs in our spine do not receive direct blood supply, and they receive water, hydration, basically by the process of osmosis. We have prostaglandins, which are inside the center of our disc, which is very similar to the same properties that are in baby diapers. And baby diapers, they can hold, 10 to 30 times their weight in water. And in the human body, the prostaglandins and the matrix, which is kind of like, it's kind of like a honeycomb under the microscope. You can see, and the prostaglandins, they'll absorb water about 3 times their weight. And they found out that discs act very similar to sponges, where when they're compressed and then they're pulled apart, it literally just draws in water, and creating that negative intradiscal pressure was a vital component, and the discovery of these decompression tables. And basically decompression is just the desired outcome of going through that phase of pulling and then resting. As a matter of fact, I've always got one. You're in a chiropractic office. You always got a spine close by, but when it pulls it apart and then it compresses it down, it goes through these phases of that. And they found that after traction, that resting phase was vital for those tissues to absorb the water. And they did it. I'm not sure if you're familiar with the study. It's a very interesting study. They put these pressure transducers, these little probes inside people's discs. And then I think it was Ramos that did this, and they put people in traction because they wanted to measure how much negative pressure they could create inside the discs. And people actually volunteered to do this. It was extremely painful. And I don't know how many people they had originally in the study, but after guys were coming out and they were telling the other guys how painful, they're like, guys dropped out. But they had just enough, volunteers that they were able to show, scientifically, that by pulling those discs, the bones apart and stretching those discs, you can create that negative suction inside the disc. So that was a key finding and discovery for these decompression tables. And, that's what I actually used a great deal of science in developing my traction units. And I created one of my proprietary portions of the invention is what's called a release strap. And the release strap allows the user to mitigate the pull force. So they can lay in the traction that pulls them, and then they pull on the release strap and it relaxes the traction so you can go through that resting phase and you can actually draw water back in the disc at home. And it's very, very beneficial. And we've had patients now using my traction units for the neck and the low back for many years, and they're having great success. So
that's awesome. I think so you have like the mechanical traction that you see at often clinics, which is like the big tables that have like multi-segments, and then you, the patient or the person, is attached to it, and you're a part of your body's anchored. And it seems as if, and correct me if I'm wrong, Jeff, but it seems as if the patient is really in control when they are using your device, that they are in control of the pressure and everything. Whereas like when someone's being attached to a machine, they're kind of at the mercy as to like the load, the weight, the rhythm of everything as well.
Yeah, true. And I've found over the years, because I have one of the big Dynatron traction tables in my office, and my patients, without a doubt, I'm not just, bragging about my baby, but my patients like my traction units better because they have control. And patients would always tell us, not in every case, but common enough, they would say, God, I don't really like that traction because I can't relax. It scares me. And the key to traction is your ability to relax, to get the true therapeutic benefit. You don't want to fight against your own muscles. And a cool thing about my traction unit, which I didn't even think about until, years of using it now, but the latex, tubing, the bungees that we use, it literally mimics, and this is something cool. I mean, you physical therapists know this because you guys use bungees all the time. It mimics a muscle. So as a muscle pulls against it, it gives, and as that muscle relaxes, it pulls. So it literally is like a symbiotic relationship with those latex tubing, and the patients can also control the amount of pull force, where they can scoot closer to the door or scoot further away from the door. And that's one component that we've been told by so many people that have used it. They said, oh my God, I love it because I can control it. And, not only they can travel with it and go everywhere, but they can control the pull themselves, and they know exactly where they'll put pieces of tape on their floor, and they know exactly where to line up, and they know that's their safe zone, per se. So,
yeah, that's good. Yeah, before we actually had the opportunity to meet up, I got a chance to take a look at your website, and I thought it was really cool, like the structure of it all. One of the big things that many people deal with, especially when they're going through bouts of sciatica and even chronic sciatica. So we're even going outside of just the, and whenever we're experiencing pain, there's this period or sense of not being in control of how you feel, because all everyone wants to do when they're experiencing pain is to get out of it. And when you're in pain, you're like, how can I control this? And it's really comforting and exciting to hear the concept of being able to control your outcomes in a way with this. And so it sounds like a really great tool. But let's talk about some in the medical terms, like we call it, what are the indications for spinal traction? So what are some things, like if someone was going through it now, traction is a tool, but rather than having a hammer and everything looking like a nail, let's talk about some things in regards to what people should be looking for, or questions they should be asking themselves, which would then allow them to consider, okay, is traction a good thing for me?
Right. Well, the great thing about traction too is it's so safe. And I would say, to start with, if you have pain that's generated from your spine, then that would be the first indicator to say, you know what, maybe traction is something for me. And I tell our customers, and I tell my patients too, go get evaluated. Go see your chiropractor, your physical therapist, your medical doctor. Go see somebody and get a professional opinion first. Have X-rays done if you need them. Have MRIs done if you need them, and kind of narrow it down to what the true cause is. And for sciatica, there are multiple causes that you could potentially be suffering from. It could be a disc bulge, could be a disc herniation. You could have what's called facet syndrome. Matter of fact, I should probably use this again. I don't want to lose anybody, but facet syndrome, these joints where the bones come together in the back of the spine, you can see they have such an incredibly close association to where the nerve roots come out. And the nerve roots actually are the source of sciatica. I think it's what, L4, L5, S1, S2. They all kind of, if you see my hand, there's all these different nerves that come out of the spine, and they join together to make this long, big nerve called the sciatic nerve. And there are a multitude of different situations that can be causing these nerves to be irritated, either at the source of the spine or somewhere down the track. You can have the piriformis muscle. You can have other things that can cause it. Bones being out of alignment and pinching down, any narrowing of that canal, which those facet joints, if they degenerate, they can get closer together. The spine, the disc itself can actually degenerate and shrink down, which closes off those canals. On this one, this is actually a great little tool. I love this little thing. If you can see here, like you see that bulging out, that is demonstrating what a disc herniation or disc bulge is. You can see how it's pressing right on the nerve. And with sciatica, it could be any of those nerves, the nerve roots that are affected, and then cause the pain to go down your leg and go all the way down to your foot. So, I would say, pain generating from the spine, numbness or tingling, even burning sensations, shooting pain going down, through your butt and down the back of your leg, behind the knee, down in the calf, down your foot, tingling and numbness in your foot. But if it does get to the point where you're actually having muscle weakness, that's a bad sign. I'm a perfect example. When I had that disc herniation in my neck, I was actually losing strength in my tricep, and it was atrophying. So when you get to the stage where you have an atrophy and weakness, that's bad. It's progressed, to a point where you're probably a surgical candidate. You need to get it checked out. You may not be able to manage that by yourself at all. chiropractic may not be able to help it. Physical therapy may not be able to help it. But I would say, I would strongly suggest exhaust all of the other avenues. Try everything first before, you have a permanent scar like this. And I got another one. I got another one in the back too, because I had bone spurs taken out after this, fusion here. But, you want to try and exhaust all conservative measures first before, of course, you do something permanent like surgery. But I would say that kind of encompasses the things to look out for, the pain, numbness, tingling, burning sensations down your leg, even muscle twitching if you have a lower motor neuron syndrome going on, things like that. But those are some key things that you gotta get some treatment. You got to do something. Something's wrong. It's just not normal at all.
I was on mute there. I agree with you. Yeah, definitely be able to communicate. And I really appreciate you saying, like, get yourself looked at first before you actually even implement it. I think it could be really challenging, especially when there's a lot of things that are going on. And I think for people to be informed and have the information at their fingertips, I mean, there's so much information about sciatica and pain and about traction, but being able to communicate experts like us to be able to say, okay, these are the steps that could be really helpful. Being able to communicate with those professionals is key. So, Jeff, this is all really helpful information. This is really great. I had a pretty good knowledge of traction and use it in the clinic, and then also have implemented in my practice as well. And to be able to speak with someone who's an even bigger expert on traction itself, it's always really exciting to learn from other folks and to be able to share their information with the world. So you're based out of Irvine, California. So you have your clinic, but then you also have Fisher Traction as well. So if someone is listening to this episode and they're like, man, traction might be for me. And it seems, or it's either like traction is for me and I have never tried it, or I've tried traction, it's been helpful, but I want to do it a little bit more and don't necessarily want to have to go to the clinic to get it done. What's the best way for people to get in touch with you, learn a little bit more about what you're doing over at Fisher Traction?
Well, we sell on Amazon, and I have a website, fishertraction.com, and I have a pretty extensive YouTube library under Fisher Traction, where I probably bore people to death with. I love to hear myself talk, and I probably bore people to death with my boring, dissertations on how to evaluate yourself, what to look for, what the possible causes are of different conditions of the spine, how to treat it, what to look for. Which it just amazes me, the power of like this, what we're doing right now, and mediums like YouTube, where there is such incredible information out there that people can get self-knowledge and empowerment. But you can email me. I still practice 6 days a week. I'm going in tomorrow. Today's Friday. I'm going in tomorrow. And I'm always attached to my email, no matter where I'm at. So, and then we have an 800 number. I have people call my office all the time, and when I have time, I talk to them about, what they're doing, and they'll send me their MRIs, and I'll go over them and tell them, okay, well, maybe you should do this or that. But I'm available at my office in Irvine. We have our website. We just changed our name. We're actually a multidisciplinary practice now. We used to be Fisher Chiropractic, and now we're Corporate Park Wellness Center. We brought on a medical doctor. I have our physical therapist, Dr. Michelle, who's here full time. So we're here and available to help in any way we can. So, yeah.
Great. I'm going to put all of Jeff's contact information, or whatever contact information, to be able to reach out to him, in the show notes. So if you want to reach out to Dr. Fisher, you can check out the show notes. And Jeff, thank you so much for sharing your information. It was really insightful. actually really opened my eyes even more into traction. I'm going to take a deeper dive into your website too. So thank you.
Awesome. Hey, you're doing a great service. I really appreciate the time. Thanks.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.